Coronavirus is still claiming lives day after day. Patients with hope to return to their families, and a virus that puts an end to those hopes, as many have slept on this bed. The beds in hospitals are filling up steadily, and the occupancy of rooms in the intensive care units achieved a record high. At the ICUs, the lives of Covid-19 patients lie between the health workers' efforts and the mercy of God. Sultan, an infected coronavirus patient, said this.
This virus, frankly, I advise all to stay away from it. It affected me in my chest, and now lack of oxygen. I was like you, I took this illness lightly, but now because of it, I'm tired, I can't talk. Even walking to restroom renders exhausted.
Meanwhile, Dr. Mohammed Zahir, specialist internist physician at Burjail Hospital, had this to say.
Unfortunately, when we say intensive care unit, it isn't only a bed and a respirator, but a whole crew of health workers, specially trained to deal with these cases. Therefore, we don't only require a building and equipment. This is the biggest worry. The increase of cases in intensive care units could lead to patients in need to compete on ICU rooms.
At the ICUs, patients are wrestling with pain and sorrow. On the other hand, there are officials who record daily cases of general and ICU patients and are closely following the hospital in the private sector, as 83 coronavirus patients are admitted at the moment, 10 of whom are in the intensive care. Dr. Mazen bin Jawad Al-Khabouri, Director General Private Health Establishments at the Ministry of Health, gave a briefing that
we have in total 25 hospitals in the private sector. 15 are in Muscat Governorate. A few weeks ago, we opened Badr as-Sama Hospital in Suhar with 200 beds, and the latest technologies, God willing, this would increase beds for hospitals in the private sector.
As COVID-19 cases increase in the Sultanate, a higher level of caution and adherence to the precautionary measures is required by all.